If you're a young man watching this and you've ever worried about your sexual performance, you're not alone. In fact, you're part of a much larger conversation that we desperately need to have. Recent studies show that nearly 30% of men under 40 experience some form of erectile dysfunction. That's almost 1 in 3. Yet somehow, we've created this myth that ED only happens to older men, leaving countless young men feeling isolated, ashamed, and wondering if something is fundamentally wrong with them. Hello, I'm Dr. Helen Brook, and today I want to have an honest, judgment-free conversation about something that affects far more young men than most people realize. I've spent years working with patients of all ages, and I can tell you that the young men who walk into my office dealing with ED are often the most surprised to learn how common their experience actually is. They come in thinking they're broken, different, or somehow failing at something that should be natural. But here's what I want you to understand from the very beginning. Experiencing erectile dysfunction as a young man doesn't mean there's something wrong with your body or your masculinity. More often than not, it's your mind that needs our attention and care. Let me start by explaining what's really happening when young men experience ED, because understanding the root cause is the first step toward healing. Unlike older men who may have physical health conditions affecting blood flow or hormone levels, the vast majority of young men experiencing ED are dealing with what we call psychogenic erectile dysfunction. This means the issue originates in the mind, not the body. Your cardiovascular system is healthy. Your hormones are functioning normally, but something is interfering with the crucial mind-body connection that makes healthy sexual function possible. The most common culprit I see in my practice? Performance anxiety. This creates what I call the anxiety spiral. It often starts with one instance. Maybe we're stressed about work, tired from lack of sleep, or had too much to drink. Your body didn't respond the way you expected, and suddenly you're worried. The next time you're intimate, instead of being present and enjoying the moment, part of your brain is monitoring your performance, asking, is it working? Am I getting hard enough? What if it happens again? This anxiety actually triggers your body's stress response, which directly interferes with the physiological processes needed for an erection. It becomes a self-fulfilling prophecy where fear of ED literally causes ED. But there's another factor that's increasingly common among young men today, and it's something we need to discuss openly: pornography-induced erectile dysfunction, or PIDE. Now, I'm not here to shame anyone about their choices, but we need to acknowledge the reality of how pornography can affect sexual function. When your brain becomes accustomed to the intense, constant stimulation of pornography, the rapid scene changes, the exaggerated responses, the unlimited variety, real-life intimacy can feel underwhelming by comparison. Your brain starts to require that level of stimulation to become aroused, and suddenly being with a real partner doesn't generate the same neurological response. This isn't about moral judgment. It's about brain chemistry. Pornography triggers massive dopamine releases, and over time, your brain adapts by reducing its sensitivity to normal levels of stimulation. Think of it like someone who listens to music at maximum volume all the time. Eventually, normal volume sounds too quiet. The same thing happens with sexual arousal. Real intimacy, with all its beautiful imperfections and natural rhythms, can't compete with the artificial intensity your brain has become accustomed to. I also want to address the role of mental health in sexual function, because they're more connected than most people realize. Depression, anxiety, stress, and low self-esteem don't just affect your mood, they directly impact your sexual health. When you're dealing with depression, your brain chemistry changes in ways that can reduce libido and interfere with arousal. Anxiety floods your system with stress hormones that literally prevent the relaxation necessary for healthy sexual function. And low self-esteem creates a mental environment where you're so focused on your perceived inadequacies that you can't be present in intimate moments. The isolation that many young men feel around this issue only makes everything worse. We live in a culture that expects men to be sexually confident and always ready, but we never teach men how to actually develop healthy sexuality. Social media and popular culture create unrealistic expectations about sexual performance, while simultaneously making it taboo to admit when things aren't working perfectly. This leaves young men suffering in silence, often turning to quick fixes like pills instead of addressing the real underlying issues. Here's what I want every young man to understand. Erectile dysfunction is not a reflection of your worth as a man or as a partner. It's a common, treatable condition that often resolves completely with the right approach. But that approach isn't usually a pill. It's addressing the mental and behavioral patterns that created the problem in the first place. If you recognize yourself in what I'm describing, the first step is to consider working with a therapist who specializes in sexual health. Cognitive behavioral therapy can be incredibly effective for performance anxiety, helping you break that anxiety spiral I mentioned earlier. You'll learn techniques to stay present during intimate moments instead of monitoring your performance. You'll develop strategies for managing anxiety and building genuine confidence rather than just hoping everything works out. If pornography use might be contributing to your situation, consider taking a break from it entirely. This isn't about permanent abstinence necessarily, but giving your brain time to reset its sensitivity to normal levels of stimulation. Many young men are surprised by how much their sexual function improves after just a few weeks of what's sometimes called a porn detox. Don't underestimate the importance of overall mental health either. If you're dealing with depression, anxiety, or chronic stress, addressing these issues will likely improve your sexual function as well. This might mean therapy, lifestyle changes, stress management techniques, or in some cases, medication for underlying mental health conditions. I also encourage open communication with your partner if you have one. I know this feels terrifying, but secrets and shame only make sexual problems worse. Most partners are far more understanding and supportive than we expect them to be. Often, they're already aware that something isn't quite right, and your honesty can actually bring you closer together while reducing the pressure you feel to perform perfectly. Remember, healthy sexuality is learned, not instinctive. We're not born knowing how to be good partners or how to manage performance pressure. These are skills that develop over time, with patience and often with guidance. There's no shame in needing to learn or relearn these skills, especially in a world that provides so little genuine education about healthy sexuality. The path forward isn't always quick or linear, but it is absolutely possible. I've worked with countless young men who thought their situation was hopeless, only to see them develop fulfilling, confident sexual relationships. The key is addressing the real causes rather than just trying to treat the symptoms. Your mind and body want to work together. Sometimes they just need a little help remembering how to do that naturally and confidently. If you're struggling with this, please know that seeking help is a sign of strength, not weakness. You deserve to have a healthy, satisfying intimate life, and with the right approach, that's absolutely achievable.